So we are recording. So again, thank you all for joining, and I'll turn it over to Kendall Smith.
Great. Thank you, Erin, for hosting us today. And thank you, everybody, for making the time to chat with us for a few minutes. I just want to quickly start off the meeting by level setting the conversation. Obviously, over the past few years, there's been a lot of conversation in Vermont about whether or not we should have a mandated paid family medical leave program and what that looks like. If it should be run privately, if it should be built into state government, what the employee share should be, the employer share. There's been all sorts of different details. But right now, we're excited to share that there is an existing product on the market that's available for employers that want to take advantage of it. We have contracted as the state of Vermont using our workers with the Hartford and using our state employee workforce as an anchor pool. Private employers are able to opt into this, and eventually individuals will be as well. And using our state employees as an anchor rate, it's more affordable, competitive pricing. If you're not offering this type of paid leave, or if you are and you want to compare what you currently pay, this product might work better for you. So anyway, we know there's a lot of conversation going, but the purpose of today is to share with you the details of what we currently have. We're pretty excited about it, and answer any questions you have. So I don't want to take a lot of time up at the beginning doing more level setting. I really want to hand it over to the Hartford. But at the end or during the presentation, as we're answering questions, we do have myself, representatives from the Department of Human Resources, representatives from the Department of Financial Regulation, as well as the Hartford representatives on the call. Quickly, Commissioner Prestigi from Human Resources, is there anything you want to add before we kick it over to the Hartford?
Yeah, hi, I'm Beth Fastigi from Human Resources, and we just introduced this program for our state employees in July, and it's been going really well. It's been really wonderful for employees. And as you all know, as employers, Vermont has a very low unemployment rate, record lowest rate in history. And we all know as employers, it's really a struggle to hire and retain employees. Workers are in demand, and if you want to hire them or keep them from taking a different job, you've got to compete to win. And one way you can do that is pay. Another way is benefits. And paid family leave is a benefit that most Vermont employees don't have. Last year, the Department of Economic Development did a survey, and only about a third of employers said they offered paid family leave. And of those organizations that do offer leave, 62% said they offered it for 6 weeks or less. So this program is optional insurance, and businesses must opt into it. And so our state's plan is approved by the Department of Financial Regulation. It doesn't rely on any public money via taxes because it's fully run by the private insurance company, the Hartford. And we competitively bid, and the Hartford won that process, and they've been fantastic to work with. The plans, they're customizable. And let's see, they're customizable, which is really important. So employers can offer, we have a base program, and employers can offer more. They can also determine if they want to share the cost with employees or pay the full cost. So then the Hartford's going to get into a lot more details in the program. And I think I'm going to just say a few things about how this program can help you with the retention of employees and hiring employees. So this program can make it really attractive to hire employees in Vermont or even elsewhere, which is good because that's something that you can say out there. We have paid family and medical leave, and I think that will help your marketing. And as well, it's really going to help your employees as well, especially small employers in Vermont. About 20% of employers in Vermont have less than 9 or fewer employees. And for a very small employer size, it's really hard to offer benefits that are affordable and available to employers. So this offering makes it possible for the really small employers to compete with larger employers to get those employees. We know we're an old state. And so this benefit can help older workers in helping them for their own medical situations or for their family. It also can help kind of those middle-aged workers, helping them to care for spouses, and then really help the younger population. Younger workers are less likely to have any paid leave at all, so this can really help them take the time off they need from earning and not take that hit in their income. We also know that BIPOC employees are less likely to have access to paid leave, so offering this benefit could help diversify your workforce and provide a more equitable workforce. And also it's good for working dads, not just moms, giving fathers the opportunity to participate in more childcare duties and bond with their children and provide more work-life balance to employees makes for happier employees. So, and keeping the workers you have, of course, is already a cost saver. So this can help you keep employees. According to Gallup, the cost of replacing an employee can range from about about half of the year's salary to 2 times that. So it's if you can retain your employees and give them a reason to stay, that will help minimize your costs as well. So I'm going to turn it over to Grant Vanderbeeken from the Hartford to tell you a lot more about the program.
Grant, before you jump in, can I just add one more piece to Beth's comments? And one thing I want to hit home is that this plan, from my understanding, and I'm sure Grant will touch on this, it provides employers with many varying options. So you can tailor it to the type of employee you have, whether it's a full-time, a part-time, or a seasonal, you have different options. And I think that will be an interesting piece for members to hear more about also. So I wanted to make sure that we brought that up at the beginning to make sure that you're aware that you have options with this plan. Okay, thanks, Grant.
You're welcome. And thank you. Thank you, Aaron. And thank you for everybody for having us on today. This is your meeting, so we're privileged to be a part of it and talk a little bit about some of the work that we're doing with the governor's office in Vermont. We tend to keep these very conversational. No one wants to listen to me for the next 90 minutes on family medical leave insurance, I promise you. So please feel free to pop any questions that you have in the chat. I've got it open, so as things come up, I'll make sure to pause, take a look at the chat, but also feel free to come off mute. I'll try to pause and as we get through some of the content, allow individuals to ask questions. 2 individuals that I just want to point out from our team here at the Hartford, Lisa Campbell, who is our marketing guru. Everything that you see on the screen, some of the videos that we're going to play, they are all Lisa's creation. She did a phenomenal job and we're so lucky to have her. And as she's pulling up the presentation, I'll also introduce Jeff Moore. Jeff is our sales rep for Vermont. So in your travels, you may see him either talking to some of the insurance brokers that are out there or potentially talking to you directly. So again, thank you for having us. We're going to talk a little bit about the Vermont Family Medical Leave Insurance product, which, as Kendall mentioned, is access to this type of program that is in part sponsored by the governor and his office. So what we'll do today, we'll talk a little bit about the product, some of the needs. As you're thinking through, this product looks and feels very similar to short-term disability. So you may have some of that coverage in place today, but we can talk a little bit about how that coverage may be a little bit different from the benefits that you have in place. So, and I guess I didn't introduce myself. There's so many of me in the chat from the invite being forwarded around. I probably missed a chance to introduce myself. So I'm Grant Vanderbeeken. I'm the regional sales director for the New England region for the Hartford. So I manage our offices in Boston, Portland, Maine, and in Hartford, Connecticut. Our territory that we cover brokers that are located anywhere from Maine down through Fairfield County, Connecticut, and then out towards Utica, New York. I've been with the Hartford 18.5 years. I make my home in southern New Hampshire. So for those that are keeping up with some of the legislative processes and some of the paid family medical leave programs, New Hampshire has a program that was rolled out earlier this year. We're also surrounded. We'll talk a little bit about what some of the other states are doing, and how we feel this program is going to be able to compete with some of the other states that you're surrounded by. But I make my home in New Hampshire. So just to level set, and I won't spend a ton of time, but I do think it's relevant to talk a little bit about how the U.S. got to where we are today, talking about Vermont family medical leave insurance. So when we look at this global map, we stick off the page. We in the U.S. stick out in terms of we do not offer any kind of paid family leave for any of our workforce. And you can see as you bring that globally, there are every other country in the world is doing some kind of program for their employees. So what this has left us with is the need not only for employers to start thinking about their paid family medical leave programs, but also states. So states that are responsible for their constituents, their voting constituents, are tackling this problem of, we're the only country that doesn't have this type of program, and what do we want to do about it? This is a very busy slide, and I will not quiz anyone on some of the dates here, but just to give you an idea of what's going on across the country, especially for employers that are multi-state. So while you might be sitting in Vermont, you may have constituents or you may have locations in other states, but just to give you a sense of the global map and now what is happening here across the country. The states that have different colors have different forms of paid family medical leave insurance programs available. And it had started as sort of California, a New York, a New Jersey type program, and it's now expanded across the country to include almost all states. The Hartford, in part, we were very fortunate to be selected to provide these products for the state of Vermont. But our plan is to be in every state that offers a private plan option. So rest assured, when you're working with the Hartford, we have a flag planted that we're going to be the premier provider of these state benefit programs. So as we developed out our product and as we thought more about what Vermonters were looking for, we listened. We listened as very interested parties so that we could tailor a program that would work for Vermonters. So we talked to employers, we talked to insurance brokers about what they were looking for in a Vermont program. Not only that, but we also wanted to listen to, what do you need to know? What do you know about the program? How do we need to educate the public at large? And you can see some of the verbatims here in terms of that feedback loop. So there's a little bit of confusion. How do I provide a program? What do we need to do to think about integration with other employee benefit programs? And the list goes on and on. But we really, in terms of developing out presentation that you're seeing here and also the product, we really wanted to listen to Vermonters or brokers that were working inside of Vermont so that we could bring to you the best educational materials that we could and also the best product. So now we're going to play a short video. The video is designed to sort of level set or set the table, so to speak, in terms of the overall program. We'll get into some of the particulars. But the goal of the video is just to give everyone a little bit of a level set for where the program is going.
For employers, retaining and attracting talent has never been more challenging. For employees, responsibilities to take care of themselves, their children, spouses, and aging parents are on the rise. Vermont is a state striking a balance between the well-being of its employers and the well-being of its employees, and the Hartford is here to help. Every day, Vermonters are securing their jobs and success through hard work and loyalty to their employers. And they're relying on their employers for wages and benefits. At the same time, Vermont companies are relying on the workforce to help them succeed and grow. And together, through this hard work and success, they keep Vermont's economy moving. But what happens when an employee needs to take time away from work for certain reasons like caring for a family member, bonding with a child, or tending to their own illness? How can the company fully support the employee during their time off and empower them to return stronger? When an employee needs to be away from work for qualifying leave reasons, the Family and Medical Leave Act, FMLA, as well as Vermont's Parental and Family Leave Law, may keep their position protected if they meet certain criteria. However, their leave is unpaid. Through these laws, employees may be eligible to take up to 12 weeks of unpaid time off for family and medical reasons without losing their position. Reasons for unpaid time off may include employee's own serious health condition, bonding with a new biological, adopted, or foster child, care for a family member, including certain reasons related to a family member's service in the military. But how much time can the average employee afford to take off if they aren't receiving any income? To help ease this financial stress, the Family and Medical Leave Insurance provides employers a way to protect an employee's compensation during leave. Beginning in July 2024, Vermont employers can offer insurance to help employees protect their income during qualified unpaid leave with FMLI, Family and Medical Leave Insurance, a voluntary insurance solution that will be offered by the Hartford. FMLI from the Hartford is designed to be flexible enough to meet the needs of Vermont businesses, large and small. Employers have many options when offering an FMLI plan to their employees. Customization options include amount of leave time covered, percent of income replacement, selecting how the program is paid for. It can be employer paid, employee paid, or shared by both the employer and employee. Eligibility can be defined by the employer, and the option to only provide family leave insurance is available. Our Vermont workforce is better when we take the long view, when we commit to caring for each other in a more meaningful way, and when our work supports our ability to care for ourselves and for our families. Many Vermont employees have job protection and are guaranteed access to unpaid leave through FMLA, but without FMLI, these leaves may be unpaid if employers don't offer other paid time off. When FMLA and FMLI work together, job security and a portion of the employee's compensation can be protected during leave. And to fit the needs of Vermont businesses large and small, Family and Medical Leave Insurance is optional and customizable. Employers will have the ability to design their own FMLI program that fits their needs and the needs of their employees. And when employees are able to take care of themselves and their families, Vermont is stronger as a whole. We look forward to working together and learning how we can better protect our Vermont workforce.
Thank you, Lisa. Deborah asked a question in the chat, so I want to reiterate that as Lisa pulls the presentation back up. So, Deborah, correct. So the program is optional. It's non-mandatory. One of the things I would be thinking about, and I believe it was Kendall that mentioned this in some of her opening remarks, while it's not mandatory, and that was purposefully done to make sure that the program worked for Vermont businesses and Vermont constituents. I think it's worth noting that Vermont is surrounded by states that have different programs. And so access, the state providing access to these programs, and we'll talk a little bit about why this program versus others, but the access becomes very important to retention of that workforce. And we'll also talk a little bit about how this fits into the overall employee benefits program. So while it's not a mandatory program, we think first of all, we think that's the right call for Vermont businesses. But we also believe that this can be a very helpful retention tool as you're competing in the workforce. Okay, so thank you, Lisa. So as we've talked about flexibility, we've talked about different mandated programs, but the goal here is to be flexible. So in terms of the overall program, we will be selling this program and distributing this product through insurance brokers. So if you work with a broker on your employee benefit program today, we are setting up time with brokers across the state of Vermont, in New York, in Massachusetts, and some of the surrounding communities to talk a little bit more about this product so that we can inform our distribution channels, our brokers about the product. We view this as the flexibility of this product as an opportunity for employers to sit down with their insurance broker, their trusted partner, and say, okay, this is what could work for me. This is how I'd like to see the family medical leave insurance work with my current benefits program. Here's the budget in which I want to work through. But we feel like that type of program flexibility, in addition to the program flexibility, the funding mechanisms. So employers can provide this benefit at no charge to their employees. They can ask the employee, similar to a voluntary benefit, to pay out of pocket for this program, or it can be cost shared. So if the employer wants to provide a certain amount and then the employee takes on the additional financial responsibility from there, we have that. So when we think about the program, it's very flexible in its administration in terms of how premiums are paid, and also plan design. In terms of the what is covered and the overall program, the feedback we've received is that it's a very simple program. It's simple to understand, especially for employees that may utilize the benefit. It's very easy to understand how this program fits into their overall lifestyle and their overall employee benefits package. And then integration. So many of you are going to have short-term disability coverage today. We recognize that, which is why you don't necessarily need to purchase both the medical portion and the family portion. The family portion of family leave insurance would cover care for an eligible family member. The medical piece would cover an employee's own health condition. Typically, a lot of those conditions are covered under short-term disability. And so there are benefits to having the medical leave, and we'll talk about those in a second, but we recognize that some of you might be very interested in the care of the family member benefit, which we will sell on a standalone basis. Answer a couple questions in the chat here. So Allison, at this point, any of the healthcare taxes, this program stands on its own today. So it'd be a complement to anything that you're doing in your overall employee benefits program. Great question from Marissa. So in terms of annual reporting, so the Hartford has an entire suite of reporting that you would have access to. So in terms of when an employee goes out and the notification back to the employer that somebody's going to utilize this coverage, we have some of those reports available. We also, so that's more utilization reports or in-time reports. We also have utilization reports. How many leave events did you have in any given period? What was their duration? How much are we paying out in claims? So you will have access to a full suite of reports available with this coverage. And then Pat, your question around healthcare packages like Blue Cross Blue Shield. So at this stage, our intent is to distribute the product through insurance brokers. That is our main distribution channel. We certainly understand how this product can complement what a medical carrier might do within their programs, but we are primarily working with insurance brokers since they are the trusted individuals that you work with on your employee benefits package. Marissa, I love the questions. Like we're going deep. This is fantastic. So the W-2 reporting requirements will be similar to what if you have short-term disability, it'll be similar to what you have on short-term disability today. There are options available there. So if you don't want us to do the W-2 reporting, we don't have to. If you do want us to do the W-2 reporting, we can do that as well. So we're very flexible there. Excellent questions. Anyone on the phone? Someone brave enough to come off mute.
So again, if you're on the phone, it's *6 to unmute.
Okay, we'll keep going. So just to give you a little bit of background on the program, and it was mentioned earlier about the state employee pool from Commissioner Fastigi. We started with the Vermont state employees. They are an anchor, a risk anchor for us that began in July of this year. We're moving into the employer phase. We affectionately call it phase 2. You can think of it as employers purchasing the coverage. And again, when I say purchasing, it really means sponsoring, meaning you can either purchase the coverage on behalf of your employees, or you can say, yes, I'd like access to the program, but I'd like my employees to elect the coverage similar to what they may do in their voluntary benefits program. We're starting phase 2, or that employer phase, with calls like this. We'll be in a place to have that coverage effective July 1st of 2024. So over the summer, you're going to see that some of the first claims start to come in for this type of coverage. We'll be quoting in early February. Goal there is to get everyone through the January 1st. For any of you that are on January 1st renewals, I'm surprised, quite honestly, that you might be on this call, because we know how crazy and hectic your schedule is as you think about open enrollment for your January 1st go live date for your other lines of coverage. But we feel like the ability to quote in February with a go live midsummer is going to allow you some time to understand your quote, work with your broker on your quote and quote refinement, and then be able to go live over the summer. Ron, good question. So we are underwriting each employer on their own. We're obviously utilizing the anchor pool that we have in the Vermont employee phase to help us balance out and stabilize some of those premiums. But when you request a quote through your broker, it will be the same census information that you'd utilize for either life insurance or short-term disability. We put that through our rating engine and then develop a quote for you. Sharon, good question here on payroll taxes. So this is optional as well. So we have options that Hartford can pay the FICA if that employee is utilizing our benefit program, or not pay the FICA. And we're talking about the employer portion of FICA. So we have options to include it or exclude it depending on what you do today. So if there's something that's going on, if there's something that short-term disability carrier is doing, we can certainly mirror something like that. Jody, great question on eligibility. So Lisa, can we maybe skip ahead? I think it's the program parameters slide. It's one. Yes, thank you. Yep. Jody, great question. Thanks for moving us ahead in the presentation here. But what you're going to see on the screen for everybody is just some of the flexibilities. Now, these are, in our opinion, some of the bigger ones that you might want to be thinking about, but it gives you a very visual representation of the levers that you can pull for a program that's going to be designed specifically for your employee population. So as Jody asked, so you can set your eligibility guidelines and requirements. You may want to do this if you have short-term or long-term disability. You may want to align that eligibility with the eligibility of your other lines of coverage. You may want a more robust eligibility. So eligibility for other state programs outside of Vermont is a little bit more liberal. So the hours worked, for instance, in any given month or any given week are a little bit lower, and we can accommodate that as well. So as you're thinking about your population, either seasonality of your population, but employees that you want to make sure have an opportunity to utilize this benefit, we can be very flexible in that. So Lisa, if we maybe just go back to some of the employer benefits, I will ask my comrades here on the call, any questions that I may have missed as I'm going through this? So I see the question from Allison on the reporting piece. So we can be flexible. So I would say, Allison, yes, the W-2s would be combined as an overall business. You'd get reporting that would show you who has been out and what the W-2 reporting looks like. We're flexible in the preparation of some of those W-2s as well. I would say this is something that, as you're potentially looking at a quote and some of the overall administration, great question for your insurance broker to talk through what some of the guidelines would be. But in general, we are extremely flexible in who processes the W-2s, who reports out on it, what gets submitted, all of those things. And Aaron, I don't want to speak out of turn, but I believe the recording we will be able to distribute, possibly slides as well.
Yes, after this call, we will send out the recording as well as the slides. And what we will do is take all of these fantastic questions as well and create a something like an FAQ so that you can have the answers quickly as well. So we'll plan to turn that around within the next day or two.
Thank you. Okay, and again, listening to some of the feedback, but why we're here today, why we think that this program is important for employers. We think retention and recruitment obviously critical, especially right now as we're looking to retain as many employees as we possibly can. Well-being, if any of you are doing any kind of well-being programs or mental health programs, the payment, not having to worry necessarily about the financial impact of taking a leave becomes very important to a robust employee benefits package. I'll back up real quick in my conversation here to the video that put out the Family Medical Leave Administration Program. So FMLA will cover typically up to 12 weeks. That is job protection. Employees do not get a paycheck typically as a part of FMLA. This program, the FMLI, the insurance portion, would be that paycheck. So that's why this is, it's not just the need for the Family Medical Leave Administration Program, but also that important paycheck. These programs will be designed by you. So if there's a price point that you're looking for, certain costs that you need to manage to, again, these programs are going to be very flexible in the way that you design them, the way you ask employees to share in the potential costs, and the way that we can help you administer them. These programs work together with short-term disability and long-term disability and any salary continuation programs you have. And then obviously in terms of the financial burden that you may experience if you have any of those salary continuation type programs, this is typically a fully insured program, although we can do self-funded programs as well. But this has the potential to lessen your impact on your salary continuation program. So another great question from Sharon: are there restrictions set by Hartford, such as waiting period before the employee gets their first check? Again, that will be up to you. And so as we talk about quotes and talk about different coverage options with your broker, that will be something that you'll be able to control when some of the benefits might be payable. Ron's question around companies' payroll. So there are a few options that we'd be able to do something back through payroll. Typically, short-term disability benefits are payable directly to the employee. We have seen some employers in other states look at self-funding some of these programs and then funneling that payment back through payroll. So we do see a few options. That's something we would definitely want to talk with you and your insurance broker about the needs that you may have as an organization. We talked a little bit about it, but I'll reiterate here. These are payments that employees in a lot of cases desperately need, not only for their own health condition, but care of a family member. So when you need to be able to go out and care for somebody, this is the payment that's going to help keep their mortgage up, keep groceries on the table when they do have to be able to be out on either expectedly or unexpectedly. Let me see if I can address Allison's question here. So Allison, typically, and if you want to come off mute, we may be able to talk about it, or if you want to set up some time with us offline, we can, if I'm not addressing your question. I
think that's a pretty nuanced question. So why don't I'm happy to connect you with Allison after the call.
Yeah, that sounds great.
So Lisa, next slide, please. Okay, the main thing that we want all of you to take away here is that the program is family medical leave insurance as a combined offering. But I want to talk a little bit about FLI, the family leave insurance, and then the MLI, the medical leave insurance. So family leave insurance, this is, as I mentioned before, this is care of a family member. It's the best way to think about it. As I mentioned before, some of you may have short-term disability programs in place, in which case you may not necessarily think about medical leave insurance as a need today. You may purchase the family leave insurance product as a standalone program. Again, supplementing what you're doing on short-term disability. Medical leave insurance, again, this is an employee's own serious health condition. You can think about it very similarly to short-term disability. There are some nuances that I just want to mention as you're thinking through which product might be right for you. But medical leave insurance is a little bit different from short-term disability in that, let's say, for instance, I needed care every other Friday. I need to be out of work every other Friday for treatment, and I'd like to use the medical leave insurance product for that. You can do increments. So if I need to be out every other Friday, I could use medical leave insurance for that part of the program for any intermittent days that might be needed, where short-term disability typically wouldn't cover that. You need to be disabled for a certain amount of time before short-term disability would come into play. You can also play around with eligibility. So if you want a specific population to have access to these products, we can do some very interesting things around eligibility for these programs. It's a long way of saying, even though you might have short-term disability, I wouldn't just throw it out because there are benefits to medical leave insurance. And we should talk about that with us and with your broker. Does Hartford have restrictions at all for the employees, such as number of claims? So Sharon, there will be an overall duration. So in terms of, thank you, Lisa, not only maximum benefit amount, but the leave duration. So we usually think about short-term disability in terms of number of weeks an employee could be out. That will be similar for FMLI. So there's a certain duration that an employee would be out. We'll go to the next slide, Lisa. So again, for your employers that might have short-term disability coverage in place today, really important to be thinking about family leave insurance, obviously care of or taking time to bond with a newborn or an ill family member. We can also wrap around that short-term disability plan. In the example I mentioned, short-term disability may not cover some areas where I may need to seek treatment on a specified day every couple of weeks. But if we think about, I'm a father of two, and my boys are 8 and 7, so this wasn't around in the state that I was in at the time of their birth. But how great it would have been to be able to go out, help my wife at the time, and care for my kids without having to worry about where the paycheck was coming from. This is a bit of an eye chart, but we do utilize it as a leave behind. You may see this document in some of your travels. This is more of an expanded version of the slide that we saw in terms of some of the parameters, some of the programs, and some of the designs. But just again, to get you thinking about how this program may work for you and what you may want to see out of the FMLI program, here are some of the product offerings that we'll be talking through when it's time to quote. So Aaron, those were our prepared comments. We're certainly willing to go back to any slides that you or anyone else had questions about.
Yeah.
But that sort of ends our prepared remarks for
Great.
today.
Thank you very much, Grant. So I made a couple of notes that I want to make sure that we reiterate. So again, the plan is voluntary and can serve as an option for employers with varying options based on what the employer chooses. It offers the opportunity to tailor your offerings to your employees. As a reminder, the program is already established and it's begun with state employees. The Hartford, will be quoting starting in February, right? So they're happy to quote you in February with a July 1st start date. And I wanted to reiterate, it's so much like working with a broker to find and purchase the right business insurance for your business. This program acts very much like that. So you work with a broker to make sure that you're accessing the proper coverage for your employees. As long as they're a Hartford affiliated broker, you can work with them. So if you have someone that you work with that's affiliated with the Hartford, you don't have to go directly through Grant or someone who's on this call.
Yeah, and Aaron, just to your sort of reiterate your last point there. So the Hartford, from an employee benefits perspective, we work with a lot of brokers. No one here necessarily needs to worry about whether or not we have a contract. We will get one. We will get a contract if you've got a preferred broker and you're unsure about whether or not they work with the Hartford. We will establish that.
Yeah.
The other piece is that we will talk to anybody. So all of you have an open invite. If there are questions that you have of us on this call, either from this call or you take this away and over the week or over the next couple of months, you think of a question, you are certainly more than welcome to reach out to myself or Jeff Moore and talk a little bit more. We will likely be asking, if you are working with a broker, we will likely ask that we reach out and let that broker know that we're speaking with one of their clients. But our goal here is to be as much an educational resource as anyone else. So if you do have questions that we can answer, that's certainly important. And then I see Lisa moving her mouse around. I do want to just do a quick plug. There is we do have a landing page for Vermont. So the fmli.thehartford.com has a ton of resources and a lot of great information if you just want to take some time to learn a little bit more.
Yeah, and again, that will go out along with the presentation slides, the recording, and the FAQ. We do have a couple more questions that have come in. Ron asked, what criteria does the Hartford use to determine eligibility for a claim?
Yeah, so that some of that can be defined by the employer, but typically we would want verification, especially for an employee's own serious health condition. Typically that's a physician statement or something from the attending physician so we can understand what that condition might be and how long that employee might be out for. Similar to care of a family member, it's just going to be typically some kind of statement from the attending physician that gives us that level of information.
And Jody actually asked a question. I think we can follow up. Is that documentation required in order to start the process of paying out?
Yes.
Yeah.
So in typically there are 3 parts to every disability claim or FLMI claim. There's the employee portion where we need some of that information. Typically, employers will ask you for some level of information, last day worked, average wages, that kind of thing. We do all of this electronically. And then the attending physician, that's the 3 parts to a claim. I will say it's, I don't want to make it sound like it's a real labor intensive process. I mean, we want to make sure we're not rubber stamping any claims, certainly. But in terms of standards to be able to adjudicate benefit programs, those are typically what you'd see, those 3 portions.
Great. One more question from Mark. Do you have a sense of premiums for a base plan as compared to short-term disability plan? He says, I realize there are different programs, but thinking this could replace or be implemented instead of short-term disability.
Yeah, if I had a nickel for every time we get that question, we probably wouldn't need to sell family medical leave insurance, but we are asked that quite a bit. So it's a very fair question, Mark. So on average, if you use the state program, which is roughly 6 weeks, if you use that program as your baseline for both medical and family leave insurance, premiums are going to be anywhere from $5 to $8 per employee per week. So that is on average, right? So I don't want anyone necessarily getting out calculators and talking to their CFO about, what the premiums might be here. As I mentioned, we are underwriting all of the cases starting in February. So before you go running off, that is just to give you a sense of a per employee cost matching the state employee plan. That's what we're provided. That's the guidance that we're providing to the market. Again, that's for both programs, the medical leave and the family leave. So if you're doing one versus the other, that cost is going to change. If you're going with a longer duration, that cost is going to change very dramatically. So I've got my favorite actuarial vice president in my ear saying, make sure people don't think that it's only going to cost that. There are parameters, but we recognize that we need to give some kind of guidance around what this is going to cost. And those are the numbers that we're using.
I think one other question is, will that the premium change as more come into the program, or will that stay fairly consistent based on the Hartford's structure?
Yeah, it's we're getting into the realm of like insurance philosophy a little bit in that obviously the more employees that you have in the program, a bigger spread of risk that you'll have. That's why the state employee program is so important, because we have premium that is going to help stabilize the overall employer program. At a very high level, of course, the more employees that you have in any given program, the costs go down a little bit. So you've got some scale as you think about adding more employees to an overall program. Some of this is going to be determined by, do employers pay for the coverage, or are they offering it as a voluntary benefit? And so you can add to the pool in some ways that way. I would say in general, I would expect that because of the state employee pool, we're going to see a good bit of stability in the overall pricing. That could be subject to change, but we've got roughly 8,000 employees in that population, and it's a very good population for us to have. So I'm expecting, Aaron, for there to be really some pretty stable premiums over the next couple of years.
Great. We have about 5 more minutes. Are there any last questions? Well, we'll see if any come in. I guess one last point I would like to make is obviously as the employment landscape continues to change, employers are hearing more and more that employees want different and more benefit options. So I would like to thank again the governor and his staff and his commissioners and the Hartford for working so diligently to bring this as an option. I think it's certainly something that it would serve as an opportunity for you to provide some of those options, those benefits that your prospective employees are looking for. I think this one, especially compared to any of the proposals that we've seen in past years during the legislative sessions, this provides much more flexibility. It provides you more opportunity to work with your employees and outside third-party providers. And it's something that I believe, we as retailers and grocers should be considering. A couple more have come in. Let's see. Should medical leave be necessary in addition to workers' comp claim? Will it be applicable to workers' comp?
Yeah, and it answered it quickly in the chat because Aaron, I
you got
love
it.
what
Okay.
you said, but at a very high level, workers' comp will cover accidents on the job,
Great.
short-term disability, and family medical leave insurance would cover anything off the job.
Yeah, and Grant, if I can just layer on there a little bit, that brings up an interesting point because not only, when folks are talking to their insurance brokers about what's happening here and how to coordinate the new FMLI programs with their traditional disability programs, there is also the workers' compensation piece of it. So as you talk to your brokers, make sure you're also addressing the administration aspect of it and how you can make sure that whatever carrier you're working with has the ability to coordinate all of these things from a reporting perspective, and from an employer perspective, from a claimant perspective, and then from a reporting perspective as well.
Good call, Jeff. Yeah, thank you.
Great. Any final questions? Seeing none, again, I want to thank Kendall. Thank you for being on, and Commissioner Vestagy, thank you for your time, and Grant and Lisa and the Hartford team, thank you for the presentation. Again, if you have any questions, please don't hesitate to reach out to myself or Karen Chaffee, she is on the call, or Alyssa Graney, she is also on the call. Don't hesitate to send us an email, call us here at the office, and we will certainly, if we don't have the answers, we will get them. We appreciate the opportunity to talk with you all. And again, we will be in touch with the recording, the FAQ, and the slides, as well as any paperwork that is pertinent to include. We will look forward to seeing you all soon, and hopefully we can support you in answering any questions that you might have after today's call. Great. Thank you very much. Have a great day.
Thanks, Aaron.